Okay, this video is healthcare reform a joke? A viewer just wrote to me, and said, Pete, you should write to Trump and see if he'll hire you to improve healthcare. And I'm like, yeah, right, bullshit. He's not going to do anything. And I just laugh and I go, it's not a health issue. It's a religious issue and a money. See, the reason why most people can never understand healthcare is they start talking about helping patients, patient outcomes. Bullshit, forget that stuff. Patients don't matter. No one cares about patients. You have to get that if you're a patient. If you want to have a good outcome and age well, no one cares about you. No one gives a rat's ass about you. That's important to know. You're just considered talking monkeys with no money. No one gives a rat's tail about a talking monkey who has no money. And that's what you are considered by the healthcare system. And if you don't think that's true, then you don't understand it. Okay? And like I said, it is not a health issue. Patient health, patient outcomes, those things are all irrelevant. No one gives a rat's tail about them. I've been a doctor 30 years. I can assure you of that. It's based on religion and it's based on money, okay? Currently, money controls religion in the United States. In the United States, the official religion is atheistic Darwinism. That is what is taught in the grade schools, the high schools, the colleges, the med schools, the academic system, the medical system. It's based on atheistic Darwinism. That's a very important point. And what atheistic Darwinism says, there is no God, okay? That man is just a talking ape, a talking monkey. He has no soul. Life has no meaning. I disagree with this, but this is the default setting of the entire system. And it also says that survival of the fittest is what determines right or wrong. Okay, what that means is if a drug company has $1 billion, they can run fake studies and say their drug is good, and that's it. That's the official accepted thing by the medical system. It doesn't matter what the real outcomes were, whatever they can get away with faking. I've studied, for example, research in the psychiatry field. They just pay some guy from an Ivy League school, $1 million, and he'll fake whatever they want to say the drug is good. Take a look at the studies. You will see that the people writing the DSM were getting paid by the drug companies, okay? That these people going around giving lectures on the drugs were being paid by the drug companies. Drug companies would write research papers, and then they would just call up doctors and say, can we put your name on this, okay? And the doctors would quite often be happy to do it. It's an easy publication. Then they get paid vacations, paid speaking tours, take their whole family, make their wife happy. Okay, and what I'm trying to say is, then when you have to decide survival of the fittest, Herbert Spencer's quote from the 1800s, well, what does that mean? What does the fittest mean? The fittest means in the market economy, it means whoever's got the most money. So the person who's the fittest, the highest ranking thing in the medical system is the drug companies, okay? They've got billions of dollars, not even millions, billions of dollars, okay? Drug companies, if they're making billions of dollars on a drug, they're happy to pay a $100 million fine. So what? Just the cost of doing business. So what I'm saying is, could you imagine for a politician, they could pay off a politician so easy it's not even funny. They buy the journal, they buy the scientists, they buy the doctors, they buy everything, okay? No one can ever compete with that, and that will never change. There's only one thing that can stand up to money, and that's religion. But religion is not even allowed to speak. If a college professor says they believe in intelligent design for the origin of life or the origin of complexity in biologic diversity, they'll be immediately fired for heresy, okay? And I believe in that. I'm an A+ student in evolutionary biology. I read another 50 books on it. I'm just telling you, that's how it is. You just have to accept reality. They don't want healthcare to change. If you had a business that was making you hundreds of billions of dollars, would you want it to change? Of course not. And you say, well, the patients want different. No, they don't. Most patients are complete ignoramuses. They don't know anything. Okay, there's a few people that maybe that study nutrition, and then what you basically have to do is learn for yourself and figure out what's the best thing for you to do as an individual. Seek optimal care rather than standard of care. Standard of care, sometimes it's equivalent to optimal, but quite often it's just take a pill for chumps. Okay, unless we return to a Bible-based view, money is always going to be more important, okay? Okay, and I had a picture here of the creation of Adam. Okay, so here it is, Michelangelo's creation of Adam. This is sort of a Bible-based worldview that mankind is created in the image of God, therefore he's part divine as well as part beast, and therefore, because he's part divine, we must do what is right by him, what is best for him. He's entitled to, the truth, to free speech, to property, to privacy, and all these things. Fine, but modern society doesn't agree with that. I'm not aware of a single country in the world that agrees with that. And that's why freedom is diminishing in the modern world. Okay, let's see. For example, unless we accept the Bible view, money is always going to be more important. A typical example is coronary artery disease. You put in a coronary artery stent, $70,000. I'm sorry, $30,000. You do open heart surgery, $150,000 for the procedure, the ICU stay, the rehab. $150,000. What do you get for teaching the vegan diet? It's taught for free on the internet. If you teach it in a hospital setting, maybe you get $1,000 or something. That's next to nothing. Okay, so there's no way anybody who runs a hospital is going to want this low-fat vegan diet stuff. Even though, what's the cure rate for stents? 0. How much does it increase longevity for chronic angina? 0. 0%. How much does cabbage increase longevity for patients with coronary artery disease? 0% typically. Okay, what's the cure rate for low-fat vegan diet with no oils, no avocados, no high-fat foods? It's about 100%. Okay, look at convalescence study, July 2014, Journal of Family Practice. Okay, about 100%. So the treatment that always works never gets done because there's no money in it. The treatments that never work always get done because there's a lot of money in it. And that's how it is for lots of things. That's how it's always going to be. And my goal is to be the best doctor in the world. I'm never going to sell out. When my time comes, they'll crucify me upside down. I've accepted that. I've accepted my fate that the best I can do is just make this little YouTube channel. Gets hardly any views, a couple hundred views for the best videos in the world on subjects that is never going to be monetized. I almost never get invited for interviews. I'm totally ostracized by conventional medicine. I'm ostracized by by nutrition medicine because almost all of them are high-fat phonies. They don't want me around. But I don't want to be an ass-kissing phony. I didn't spend so much of my life lonely and work so hard to sell out and be an ass-kissing phony and promote soy and caffeine and coffee and tea and nuts and seeds and olive oil, omega-3s, MSG, MFG, all this BS. I'm not going to do that. I would hate myself. I'm not like some politically correct person. I don't believe in multiculturalism. I think Christianity is superior to other cultures. I don't think there's any comparison. I mean, where are the paintings from the other cultures? All the other cultures, they suck at painting. They're not even kind of good. They all suck, okay? They all stink at music compared to the Christian culture, okay? They stink at literature compared to Christian culture. Name one that's close. Some of them have a few good books here and there, sure. But compared to Christian literature, they stink, okay? Architecture, the original universities and science. Harvard used to be a good university when it's Christian. Now it's a phony piece of crap. Okay, so anyways, I'm not going to ever be involved in healthcare reform because it's a joke. I'll just make this little site. The few people that are motivated enough to find it will benefit from it, and we'll leave it at that. And I don't think healthcare is going to ever reform. Don't hold your breath. I don't think anything good is going to happen in healthcare.